Hi, my name's Tracy Webb. I'm the Associate Director of Collaborative Change for the Q community. And in this session, we're going to be talking about the skills that are needed across a team for collaborative and creative problem solving. We'll be introducing a skills map and user guide, which highlights the skills and attitudes required for this kind of work and provides you with exercises that you can do with multidisciplinary teams to explore your collective strengths and areas for development. We'll be hearing today from Anandita Ghosh, who's Q's Innovation and Development Lead, about what the skills map is, how we developed it, and also from Sonal Mehta, a pharmacist and self-care lead from Milton Keynes CCG, about her experience of collaborative problem solving and how she thinks the skills map can be used in the current health and care context. So Anandita, I'll start with you. You've worked with Nesta to develop the skills map tool. Can you tell us a little bit about why and how we developed this?
In the Q Lab, we've had the privilege of supporting people to collaborate and work together to tackle complex challenges. Through this work, we've seen the energy and motivation people have to work together well. But we also know that collaboration can be hard. We see a lack of awareness and investment in the skills and behaviours needed to collaborate well, and this can really undermine people's efforts. At a team level, it can be hard to create the time and space to have conversations about what people bring when they work together to solve problems. And there's often an assumption that people can automatically do this well. So we wanted to create a tool to bring these skills to life for people working to improve health and care. We worked with Nesta, the innovation think tank, to develop the skills map and user guide, and it builds on their international learning in this space. And we've also drawn on expertise from the wider improvement community, including the authors of the Health Foundation's Habits of an Improver, practical learning from Q members, and people involved in the Q Lab, including practitioners, patients, and service users. We think we need to be more explicit about what the skills for collaboration are and start to invest and value them across the system. So I hope the skills map will support that in two ways: raising awareness to what these skills and attitudes are, and support meaningful conversations in teams about what we're bringing to our work together.
Great. And how do you think that people working in improvement can use the skills map to help them do their day-to-day work?
So firstly, I think there's already a great culture of collaboration within improvement. And I can really see that in our work in the lab and in Q, that teams display many of these skills and often use them without even noticing. So I think by naming these skills and really encouraging people to understand and assess where their team's strengths lie and where they need to develop, it really brings visibility to what they are so we can move to support existing improvement efforts. Secondly, the skills map is practical. It was really important that this was something tangible that people across all levels could use in their day-to-day jobs. So it's built as a tool for reflection and comes with a range of suggested activities for people to build on. It's designed for busy people and particularly useful for multidisciplinary teams working with patients and service users.
And then could you tell us why the map focuses on skills and attitudes, and specifically why these ones?
So the map sets out skills and attitudes that have been shown to be important based on the research and practice that I've just mentioned. And we want to encourage users to think through the importance of these skills in their work and the blend that may be required across their team and organisation. The central hexagon identifies the key attitudes that foster creative and collaborative problem solving. Attitudes can change, but are deeply ingrained, so they don't change easily or quickly. So looking across your team holistically can help you make the most of people's natural preferences. The surrounding hexagons identify 3 skill areas that are core to collaborative and creative problem solving: bringing people together, learning by doing, initiating change. 3 specific skills sit within each area. Skills are easier to learn and develop than attitudes, and we can take a deliberate approach to supporting people to develop them. Ultimately, this is a tool for reflection and empowerment, not evaluation. So it's really designed to support individuals, teams, and organizations to consider the skills and attitudes that apply regularly in your work and those that might need developing. For improvement work to be successful, we need technical expertise as well as these skills for collaboration. Both really need to be explicit and valued to do improvement work. There's a great Don Berwick quote that sums it up. He says, "Improvement isn't rocket science, it's people science, which is a heck of a lot harder."
Great, thanks very much, Anne and Dita, for that introduction and overview. Sonal, I'm now going to turn to you. Thank you so much for joining us this morning. I wondered if you could just tell us a little bit about the work that you do and how you collaborate with others in your day-to-day work.
Sure, thanks for having me here, Tracy. So I'm a pharmacist. I've got two roles in my job. I'm a pharmacist on the one hand, and I cover 7 GP surgeries through that role. So I work with a wide range of stakeholders and partners in that role to support GP practices to improve their prescribing and the handling of medicines. Alongside that as well, there's also a lot of changes in the pharmacy profession. So there's new roles coming into general practice for pharmacists. So I'm supporting development and integration of those roles into primary care. And then the other aspect to my role, the self-care lead, that's been about working with stakeholders and partners across the health and social care system, reaching out into communities, the voluntary sector, some private businesses and social enterprises as well, and really trying to work with as broad a range of people as possible to support the development of the knowledge and skills and behaviours that people need to be able to look after themselves a little bit better.
Brilliant, thank you very much. And Sonal, could you tell us about how you've used the skills map to date with the team? You were involved in testing it and working with us at an early stage, and also how you plan to use it in the future to help you deliver the collaborative change that you're working on.
Yeah, so I had the opportunity to give the skills map a test drive when it was still in its draft form. So I took that to my pharmacy team. That was about 1.5 years ago now, I think. So we gave it a bit of a test drive, and we thought it was a really interesting way of kind of assessing ourselves as a team, and kind of understanding a bit more about where our strengths and our weaknesses are.
So Sonal, you've described new roles in pharmacy, you've described different people working together in new ways. I guess one thing that struck us when we were developing the skills map was that often when you come together to do some work together, it's easy to just dive into what are we trying to achieve? Let's get on and do the project. And it's hard to take time to really think about how we're going to work together. What's this going to take? How do we need to behave and act and think? And I wonder if kind of you could share your experience of that. Does that mirror your experience, or are you finding that actually having those conversations are valuable up front about kind of the skills that are needed?
I think it's really important to invest that time up front. I think, as you say, it can be when everyone's really enthusiastic and passionate at the beginning of a new piece of work. I think it can be easy just to dive in and you assume because we're all starting from the same place, we're all going to kind of go on that journey at the same pace with each other. But I think sometimes challenges obviously come up, and I think when you've done that upfront investment, I think then it allows you to to kind of have a bit of a toolbox that you can draw on when conversations start to become difficult, and maybe there's a few more challenges and hurdles coming up. I think that kind of it's almost putting in a bit of preventative work at the beginning to kind of say, well, if we understand some of these dynamics a little bit better and some of the the varying skills, then I think it becomes easier to sort of maybe have some of those challenging conversations because you've started from a place where you've been quite open and transparent with each other.
Yeah, that makes sense. And as Anne and Dita said, we've kind of designed this tool for busy people. We know, like, now more than ever, people are so time poor. I guess we're thinking that this doesn't have to be like big team away days or whole days when you sit and kind of talk about this for a long time, but actually if you can do some little and often conversations about how is this partnership going, how is this collaboration going, what do we need more or less of, that can really make the difference.
I think that would be a really helpful way of utilising this tool as a team. That that where you sort of have a long-term working relationship with each other. I think it's almost developing the habit of having these sorts of conversations with each other, because where I say we gave it a bit of a test drive nearly sort of 18 months ago now, we didn't really revisit it after that. And I think while everybody found it a valuable exercise, I think it was important. I think we should have then had follow-up conversations to try and understand, well, what does that mean? And maybe if we'd done that sort of pre-COVID, then some of the challenges that came about during the COVID response, we may have been able to tackle some of those a little bit better.
Anandita mentioned that when we were developing this skills map, we worked with healthcare professionals from different parts of the sector and also with patients. And I guess we were really keen that we developed a tool that could help people to have good conversations between patients particularly and professionals. We tried to avoid, where possible, kind of NHS jargon, tried to make sure that the exercises it didn't just have to fit in team meetings, but could genuinely facilitate good conversations between patients and professionals about how they might work together, the different skills that they bring, how they would approach a piece of work. And we think that that's kind of fairly unique about this tool. I just wondered if you had any reflections on that, Sonal, particularly drawing on your experience of work that you've done in your self-care lead.
Yeah, so I think I think the thing that I really like about this skills map, to me, I view it as a leveler when you're trying to bring very diverse people together that have very different experiences and the perception that people may have of their own skills and another person's skills. So where you're trying to bring professionals and expert patients together to maybe do some co-production around a particular disease area, for example, it could be that actually bringing patients into the room with consultants and trying to have an equal conversation could actually be quite intimidating for patients. They may sit there thinking, well, I don't have the necessary skills or experience or attitudes to kind of be here. But I think the language of the skills map is quite generic, and it really doesn't, I don't think it matters whether you're a member of the public or a professional with so many years of training and experience behind you, because it's about your skills that can be developed, and it's about the attitudes that you bring. And I think undertaking that exercise at the beginning actually could act as a really great leveler between professionals and patients.
Lovely, thank you so much, Sonal. So that was just a quick overview, and we'll bring this session on skills for collaborative change to a close. As we've just been saying, throughout the COVID pandemic, teams and organisations and individuals have collaborated in new ways, with many people kind of feeling like they had the license, perhaps irrespective of job title, to work collaboratively on a common goal during this period. Policy documents are really kind of backing up that move towards collaboration. The NHS People Plan says that, building on this experience that we've all had recently, all leaders in the NHS, particularly those who hold formal management and leadership positions, are expected to act with kindness, to prioritise collaboration and foster creativity in the people that they work with. I think this is a really admirable aim, and we hope that the skills map and user guide will help people to do this difficult work well. So you can download the map from our website, and please do feel free to share comments on the website or via social media. We're really interested in people's experience of using this and keen to hear how you get on. Thank you very much for joining us today. Thank you to Sonal and Anandita.